Well, Patients and Families United is a public education and support group for the state's medical marijuana patients, regardless of their medical condition, and for pain patients, whether they use marijuana or not. Our highest objective is to further legislator and public understanding of the science and the policies that affect the lives of these patients detrimentally, much of it due to the so-called war on drugs. As regards medical marijuana, we hope to improve the law in a few very reasonable ways that would make it much more workable for suffering patients so that they don't have to fear arrest, prosecution, and incarceration in spite of the will of the voters, which is still a problem for a number of patients. And in terms of pain patients, whether they use marijuana or not, we're very concerned about the proposal for a prescription drug database monitoring program that in fact we think would deter physicians from improved pain treatment and make no positive improvement in the lives of people who suffer chronic pain. National data suggests that there are at least 22,000 Montanans who live with chronic, severe, daily pain that is undertreated at best, and for many of those patients, not treated at all. We're hoping to raise awareness of these really unfair problems and to make some progress in policies that pertain to these issues.
You mentioned changes. Can you just give me a few of what are some of the highlights of the kind of changes that you want to see made in law?
Well, we think we'd like to see nurse practitioners and physician's assistants who already can prescribe any prescription drug. We'd like to see them have the authority that physicians now have to make medical marijuana recommendations when warranted. And we'd like to see patients who suffer from terminal or permanent conditions be able to register with the State Health Department for a period of 3 years rather than having to go through all the process, the expense and the bureaucracy of re-registering every single year.
Are those the top of your policy agenda for this session?
That, as well as increasing the amount of medical marijuana that a suffering patient is allowed to possess in order to know that he or she is not going to run out and suffer unfairly.